Will. He's my patient. Okay, first we're going to be talking about asthma today. We're going to be talking about ways to prevent asthma and asthma attack, like avoiding triggers such as allergens, chemicals, things like that are inhaled, as well as medications to be used and how to use them, as for example like inhalers and nebulizers. So first we're going to talk about inhalers and nebulizers. So these are inhalers. We have the powder dose inhaler, so you crank this right here. You crank this right here. You take a quick breath, hold in as long as you can, and then let it go in. And you want to make sure that you're drinking water with this to get all the medication down. This is a meter dose inhaler, so you'll take it, you'll shake it, and you'll press down this thing right here, and you'll breathe in quickly and hold it as long as you can, and then you'll breathe out. And you can do that once or twice with the meter dose inhaler. So for these, asthma is a disorder that it constricts your airway, and it also causes histamine release to create inflammation in the lungs. And so we use bronchodilators to open up the airways. And then we use anti-inflammatory medications through the inhalers or nebulizers to decrease the inflammation and decrease the release of histamine to the lungs in order to get enough oxygen. And you can also use steroid medications as well. So going back to the ways to get those medications, you can also use a nebulizer. So the nebulizer actually makes the medication, you put the medication in this right here, and it actually makes the medication into a mist. And we really like using nebulizers because it gets more of the medication back into your lungs instead of getting caught at the back of your throat like the inhalers tend to do. So we use those. Same with the bronchodilators, anti-inflammatory medications, as well as the steroids to help open up your airway and do that. So we also want to teach you about how to avoid any triggers. So if you have any specific allergies that cause effect to your lungs, such as being allergic to dust, perfumes, any kind of bugs or pets, we want to make sure that you know how to avoid these triggers. That's the most important thing to do, is avoid them. So making sure to keep your house clean from the dust. If you're cleaning top shelves or ceiling fans, making sure that you're having something to cover your face so you don't get dust particles in your lungs while you're cleaning. Making sure that you are avoiding having any pets in your house, and if you do have pets, making sure that they're hypoallergenic so that they do not affect your allergies. Also, if you were going out and you know that if you're going to a friend's house and you know that they have pets that you're allergic to, making sure that you're taking your allergy medication and just trying to stay clear of in those situations. Also, we want to make sure that you know that any kind of perfumes or chemical sprays, like spray paint or painting a car, like that has aerosol sprayed paint, those chemicals can easily get into your lungs, and that can really aggravate your asthma and cause an asthma attack. And you want to steer clear of those. If you are doing those things, you need to make sure you're wearing a protective mask that has a filter so that the chemicals cannot go in through your nose or your mouth into your lungs. We also want to make sure that if you're painting inside, making sure that you're opening the windows, the doors, to make sure that there's circulation in your house. And if you can take the project outside, it's super important to go outside to make sure that the air is circulating through so it's not in an enclosed area. But still, whether inside or outside, you're still making sure that you're wearing that protective mask. And the last really big trigger for asthma attacks are smoke inhalation. Anything that you are putting in your mouth and you're inhaling it into your lungs, those chemicals that you inhale can really aggravate and inflame your lungs, and this is what causes the exaggeration of constriction and inflammation in your lungs, which is really bad. So we want to make sure that you're really avoiding those triggers. So again, with the inhaler, you're shaking the meter dose inhaler and taking a deep breath in, quick breath in, and holding as long as you can. With the powder dose inhaler, you're cranking back the lever and keeping it, making sure it's flat so the powder doesn't fall out. And you're taking a slow, deep breath in with that as well. Making sure that you're washing out your mouth, especially with the steroid medications, because it can cause something called thrush, which is a bacterial infection. You don't want that to happen with your steroid medications. And then with your nebulizer, making sure that you're completely covering the mouthpiece and only breathing through your mouth and never your nose so that you can get all the medication in, and that takes about 10 to 15 minutes. and then making sure you're avoiding those triggers of allergies and anything like that. So with this, I would then hand my patient handouts for how your medications work, how those devices work with the inhaler and the nebulizer, and then also a pamphlet, maybe a specific allergies circled, a pamphlet for that in case they forget how to avoid those triggers. And then as well, making sure that they know which medications they're taking specifically and how those specific medications work. I would then ask my patient to repeat back to me about the medications and inhaler and nebulizer and how to avoid their specific allergy triggers or just environmental triggers. And if they were confused or couldn't recite back specifically or forgot, then I would go ahead and re-educate them on that.